I went to my family doctor in March of 2023, and we did a PSA blood test, and my numbers had elevated over the year. And so she referred me to PCI urology.
Men should generally start screening for prostate cancer at around age 50. If they have risk factors for prostate cancer, they should start screening earlier. Risk factors would include a family member that has had prostate cancer, primarily a first-degree relative, father, brother would be the primary for those. In that situation, they should start 10 years earlier than the age that their primary relative was when they were diagnosed with prostate cancer. My father had passed away from prostate cancer, and so that kind of changed my schedule a little bit. So we scheduled a biopsy, and I got the phone call that I was diagnosed with stage 3 prostate cancer, and we talked about what we should do. And he gave me 4 options, and we decided on the prostate removal. My first reaction was I was scared, a little shocked, and then I called Julie, my wife. She said, "We'll get through this." I felt good about what we had decided to do. Then in 3 months I came back and my PSA numbers were at 0. Felt real good about it. So we came back in 6 months and they had elevated just a little. Dr. Hoxie decided to have me meet with Dr. Isaac. Patients generally have a choice of which treatment will work best for them. Sometimes it's more convenient to do radiation versus surgery. Sometimes it's more convenient to do surgery versus radiation. In his situation, it was more convenient to do the radiation.
As my role as a social worker with the Nassif Community Cancer Center, we are looking to assess people at their initial consultation, to look at their basic needs, their social and emotional needs, their spiritual needs, and any financial concerns that they may have.
Barb was wonderful. I really needed that in this situation, just someone to talk to. And I would sit there and I would get emotional, and she just dealt with it and encouraged me and said, Ed, just let it go. Just let it go. Just say whatever you needed to say.
A lot of my conversation was helping him to find ways to help relax, help to reduce that anxiety and distress that we assess for as well.
And one of the things about Ed is he would always want to educate patients. He'd always kind of coffee talk in the weight room. He would pull in, can I help you with anything? Or kind of patients going through a harder time. They'd always kind of rely on Ed to tell them, hey, how do you do? What do you do? And it just seemed a lot less scary for them, and he was always willing to help.
The moment I stepped into this radiation center, I felt like they were my family. They treated me like I was their best friend, and I knew right away this was gonna be a great experience. Nassif Community Cancer Center. Face cancer with confidence.